Sometimes if we have a real critical patient and we don't have that capability, we don't have the specialists that we need, and we usually send our patient up north or in Little Rock.
As a CEO in a small rural area, it's very difficult to recruit physicians. And just getting family practice physicians and general surgeons is a chore.
As it happens, we're geographically in the center of the state, so we're situated to receive patients from all around, but it can be 2-3 hour drive for them to get here.
Now we are transferring them to Columbia or Springfield, which is an hour and a half to 2 hours away, which puts the patient's family out and staying in a hotel.
We were very hesitant at first because Mother, she said, well, I can't do that. There's no way, I don't know what to do with it.
And once you know what to do with it, you never want to do without it.
We don't have to stay with her 24 hours a day. Plus, it has kept her from having to go to the doctor as often, and it's kept her out of the hospital.
This type of technology is changing the future of healthcare, and it's become such a focus that it's being discussed at a national level.
Arkansas is going to be in the bottom for a lot of things like overall health and obesity problems and underserved areas. When it comes to like the potential for telehealth, for electronic treatment and such, we're in the top 5, which is kind of unheard of for a southern state that's typically on the poor end of things to have such, it's not even a Cadillac, it'd be like a Mercedes network that they have in place, and we're just starting to use it. So potentials are huge.
To understand how Baptist Health is helping to change healthcare, you need to go back to 2005, when Baptist Health became the first in the state and one of 20 prominent healthcare systems in the country to launch an eICU. Using powerful technology and private high-speed data lines, critical care physicians, experienced critical care nurses, and healthcare assistants can accurately monitor and treat ICU patients at a moment's notice from this command center on the Baptist Health campus in Little Rock. It does not replace the care at the bedside, but it provides additional support to ensure the best possible outcome. Since 2005, Baptist Health has used eICU technology for its own hospitals, but that is changing.
There are some situations that a patient needs to be seen by a specialist or intensivist. If we have that capability like eICU where they can be watched and treated by an intensivist from a distance and help the local physicians in our community.
Baptist Health's vision is to improve the health of Arkansans by changing the way healthcare is delivered. With grants from the USDA's Distance Learning and Telemedicine Program and the Department of Commerce, rural hospitals all across Arkansas are partnering with Baptist Health to indeed change the way healthcare is delivered.
I do believe it is a partnership. It is a partnership with an association that we have had many good results from. Our physicians in the area have transferred patients to Baptist on many occasions, and the results that we see is what makes them continue to send patients to Baptist. And so to bring Baptist to us has been a great opportunity for us.
Margaret West is the CEO of Magnolia Regional Medical Center and is quick to show off the new technology that is now available to her patients in the intensive care unit.
This is Vicki, and I'm at eICU Little Rock. Let me zoom into that. I see important phone numbers, eICU number, eICU tech support.
It's just like being in Little Rock in the Baptist unit, and to have them right here at home, and that's great.
Travel further east and close to the Louisiana state line, you'll find Ashley County Medical Center in Crossett, where Dr. Remmel Buselig sees added benefits to his patients.
There are some situations that family are not able to travel and see their family or their sick members of the family because of the distance. And I think being here in our hospital, being treated, great chance for the family to be with their sick member of the family.
You get to have the familiarity of your hometown, your family, your physician, while we have the advantage of all the specialists that are available through the eICU. That's the beauty of the program.
And the beauty for Baptist Health's home health is to keep patients out of the hospital and at home using telehealth technology.
Good morning. Are you ready to start your health check?
For 89-year-old Ophelia Eisen, it means being able to stay home with the help of nurses.
Hello.
Hello, Ms. Harlan. This is Donna Johnston, Baptist Home Health Telehealth Nurse.
Yes.
I was just calling to check on Miss Eisen this morning. I see her blood pressure is very good this morning, 128/53.
Yes, it is. And her breathing is a little better today.
Good, that's good. Did she sleep well last night? Telehealth or telemonitoring, they're terms that are used interchangeably. And for home health, what it entails for us is the deployment of equipment into a patient's home, a set of scales, a blood pressure cuff, and a pulse oximeter that will check their oxygen saturation level that we teach the patient how to use on a daily basis, and it's transmitted either through the phone line or through a cellular signal and comes back here to the home health office where an RN can review it and watch for trends.
We lost my dad, it'll soon be 2 years ago. This is the only tie that she's got. If she wasn't able to stay at home, I truly don't know what we'd do.
Oh, I love it, and I couldn't have gotten by without it, I don't think. Couldn't do without you.
How fast did you notice your heart rate to go when you felt your symptoms?
Up to about 160.
Any dizziness? You felt like you're about to pass out?
Yeah, short of breath, felt like I was going to pass out.
Okay. Got our Bluetooth already hooked up. And if you can put that to the patient's just the right upper sternal border, whatever they listen to there, they have it on the patient in whatever town, Arkansas, hours away. I can hear it here, and it's just as good of quality, maybe in some cases a little bit better than what I might hear using my own stethoscope. All right, that's fine. You hear that very well. Over to the left sternal border. What it means to patients, they can now see a doctor in Little Rock, and everything that we would offer at this medical center in any small town in Arkansas, where they can get on that link to us and we can see them over telehealth. Then we can deliver any of the cutting edge stuff to the smallest town.
And changing the way healthcare is delivered is not limited to Arkansas. Welcome to Fort Leonard Wood in Missouri. It's commonplace at military bases to see soldiers stop and face the flag. But what is not commonplace is a civilian eICU within a Department of Defense hospital.
This is the first time that the Department of Defense has embarked on an eICU effort. And here at Fort Leonard Wood, we're really excited to be working with Baptist Health and hope to demonstrate the success of the eICU pilot and improve the care for our patients here, as well as the patients' family members here.
General Leonard Wood Army Community Hospital in South Central Missouri cares for patients of all ages. To have quick access to specialists is important to nurses like Shelley Wiley.
We will have the availability of a physician and a critical care nurse with the same background that we have at our fingertips. At the push of a button, they will be in the room with us and talking to us and discussing the care of the patient. Whereas before eICU, I would actually have to page or telephone a physician and give them time to get back to me. So this is, within seconds, I can have a physician at the bedside.
Fort Leonard Wood worked with the Department of Defense to establish a contract for its eICU program, and they looked at partners across the entire country.
The contract was awarded to Baptist Health based on their historical performance and based on their capabilities, and we're really excited to be working with Baptist Health for our eICU.
Network that's set up, and this is already in place, everything is in place. It's kind of the equivalent of a 6-lane interstate that goes everywhere in the state, and there's only a couple of cars on it right now.
I think this will save lives.
eICU will actually be a godsend for our nurses.
I think that this project has the potential to to really show how small hospitals in rural settings can work with big hospitals in urban settings and improve the care of patients, not only in the small hospitals, but also in the urban settings as well.
I think that's the future of rural Arkansas, is to move into technology like this.
I think we're just scratching the surface of what the potential is.
Baptist Health, making a real difference in patients' lives in ways and places unreachable in the past.